Good morning, Dr. Vikram.
Good morning.
Dr. Vikram, there are many people who are suffering with the kidney failure problem, and there are generally two stages. One is initial, and one is people who are undergoing dialysis.
Yeah, yeah.
And both the situations are very much unmanageable by the allopathic treatment they are undergoing.
Yeah, yeah.
So, is there any treatment of this kidney failure available in Ayurveda?
Ayurveda has a lot to offer in kidney failure patients. Usually, kidney failure is caused by the chronic, persistent, uncontrolled diabetes or uncontrolled, prolonged chronic blood pressure. So
Okay.
these are the two major illnesses underlying the kidney failure.
Okay.
There are some other reasons also, but they are very less.
Uh-huh.
10% of patients who suffer from
Okay.
kidney failure because of those.
Uh-huh.
So, blood pressure and diabetes, these two conditions should be in control if
Okay.
they want to get control of their creatinine levels.
Uh-huh.
Usually, creatinine levels they remain stable if the blood pressure or diabetes is in control.
Okay.
But in some cases, they keep on increasing. So
Uh-huh.
then, when they reach at certain level, when the creatinine level reaches 9 or 10,
Uh-huh.
and the urea level reaches about 200 or 220, then there is need to go for dialysis.
Okay.
But there are certain Ayurvedic medicines which can reduce the urea and creatinine levels.
Okay.
Even I have seen in many chronic patients in CKD4 or CKD5,
Uh-huh.
if the creatinine level it becomes stable or it may become come back little,
Okay.
reverse.
So somehow people can manage with the herbs.
Yeah, somehow
That's
the kidney failure can be managed with the herbs,
Uh-huh.
and the dialysis can be avoided.
So which herbs generally you prescribe for this condition?
There are so many herbs which I recommend. Some combinations.
Okay.
I recommend this Punarnva. It's called Borevia diffusa.
Mm-hmm.
It's a creeper on the
Okay.
ground.
Uh-huh.
Punarnva is very widely used by people who know this herb
Yeah.
anywhere in the world. And this there is Phalanthus I use.
Okay.
There is Kasni. Kasni is Cichorium intybus. I use the leaves, not the seeds or the root. So
Okay.
seeds and root of this herb are mainly used by the most of the doctors in Ayurveda. But I recommend using the leaves because
Okay.
leaves they give the results.
Uh-huh.
And this Gokshura is wonderful. This Tribulus terrestris.
Okay.
I use Tribulus terrestris for my patients. I use the pine bark formula, pine bark tablets.
Okay.
Pine bark is very good for kidney failure,
Uh-huh.
reducing the urea and creatinine level.
Okay.
And I use the Punarnva, Kasni, Gokru, pine bark, and I use a Indian echinacea. It is called Kal Meg.
Okay.
It is king of bitters. I use in capsule form, 2 capsules morning, evening.
Okay.
And there is another wonderful herb called Revandachini. Revandachini is called Rheum imodi in Latin.
Okay.
So Rheum imodium I use the root powder,
Okay.
and once a half spoonful morning, evening.
Okay.
And take care of the underlying condition, blood pressure and diabetes. It is very important. Also avoid too much consumption of this proteins.
Okay.
I don't recommend too many proteins because proteins, the metabolism of proteins leads to increase in the urea and creatinine level.
Okay.
If the hemoglobin is low, people are using this erythropoietin hormone.
Yeah.
This is the injection.
Yeah. Many nephrologists recommend.
Many nephrologists they recommend erythropoietin. That can be used, but I have recently observed that sometimes can increase the urea creatinine. So try to consume natural foods which are rich in iron, which provide you nutrition, and deep breathing exercises
Okay.
are also very important.
Okay. Dr. Vikram, one major problem with the kidney failure patient is this nausea, vomiting feeling, itching is there.
Yeah.
So, is there any remedy for
When
this?
the urea and creatinines they increased in the blood, they cause the feeling of nausea, vomiting, loss of appetite,
Okay.
fatigue, weakness, lethargy, and fullness, and itching in the body. So there are these medicines which I have recommended earlier, the pine bark and the echinacea and the phalanthus and this Ren Cure,
Okay.
and then Mutra Krichantak. This is a powder called Mutra Krichantak Churna.
Okay.
It's a classical Ayurvedic formulation,
Okay.
combination of about 8 to 10 herbs.
Mhm.
So that is very good for getting rid of all these symptoms
Okay.
and reducing the urea creatinine levels.
Okay.
And there is a simple home remedies. People suffering from nausea, vomiting, feeling. Just take one spoonful of fennel, cumin,
Okay.
and thyme,
Okay.
jeera, saunf, and ajwain.
Okay.
So this is jeera, saunf, ajwain in Hindi,
Uh-huh.
and thyme, cumin, and fennel in English.
Okay.
So this take one spoonful of each.
Okay.
Boil in about 400 ml water
Okay.
until it remains about 50 ml,
Uh-huh.
and then just strain it,
Okay.
filter it,
Okay.
and then just drink it.
Okay.
Just make fresh every time, because
Oh.
you cannot use preservative.
Okay.
Make fresh every time.
Right.
So this will help in fighting the
Nausea, vomiting.
nausea, vomiting feeling, and
And,
even the itching also.
And what I most of you asked about food. Is there any safe food which almost everyone can take, even diabetic patients?
There is a thing called sabudana in Hindi.
Uh-huh.
It is called tapoika
Okay.
in English.
Okay.
So tapoika pudding or sabudana kheer.
Uh-huh.
The tapoika pudding is free from cholesterol, from potassium.
Oh, major
So
concern.
there is 0% potassium in sabudana,
Okay.
in tapoika.
Uh-huh.
So its dry tapoika can be used to
Uh-huh.
make a pudding,
Okay.
kheer. So that can be consumed.
Okay.
So that is very energetic also. That is rich in folate also,
Okay.
and free from any potassium and.
Dr. Vikram, one more question
Yeah.
I say.
Yeah.
Like many patients, they call me and they ask like for how long they need to use to restore their kidneys, and how long they have to use herbs, or they can use it for regular lifelong or not.
Yeah,
So
yeah.
please explain.
These herbs are very safe in nature,
Uh-huh.
so they are free from any chemicals or any. They can be used along with the ongoing allopathic treatments,
Okay.
and they can be used lifelong.
Uh-huh.
And as soon as the kidney function is restored, this depends on various people.
Yeah, not in all
The
the
time period
patients we
can be
can
different
restore.
in different people.
Uh-huh.
It can be 6 months in one person, it can be 2 years in another person.
Okay.
It can be 3 months in some person.
Okay.
So
It
depending
depends on the stage,
depends
basically.
on the stage
Uh-huh.
and the condition of the person.
Okay.
But all the patients, they tell me that they are feeling better. They respond to this treatment.
Okay.
The results are very good. The creatinine level decreases in
Okay.
almost every patient,
Uh-huh.
and all are satisfied with this treatment.
Uh-huh. So basically your suggestion is to use herbs rather than going for dialysis to manage this disease.
I am saying that if dialysis is necessary, if the level has reached some optimum point,
Okay.
some point where it is inevitable,
Uh-huh.
then one can go for dialysis.
Okay.
But even if one is undergoing dialysis, still he can take Ayurvedic herbs,
Okay.
and he can, if the creatinine level reduces, comes down to the limit, then he can avoid cut down dialysis.
Okay.
Yeah.
So
There
it's
are
a-
patients in my practice
Uh-huh.
who were on the dialysis before, and after using the medicines, now they are
Okay,
free
we are
from
managing
dialysis.
with herbs only.
Yeah.
And one last question, Dr. Vikram, many
Yes.
viewers ask, they are worried about the heavy metals and things like that are used in Ayurveda.
Yeah,
So
yeah.
please clear their doubt.
It's a common question
Yeah.
people they ask,
Uh-huh.
and they are concerned about, especially doctors.
Uh-huh.
Heavy metals, if I use heavy metals in a kidney failure patient, of course the kidney is going to fail.
Okay.
So it is very important that heavy metals should not be given to any kidney patients,
Okay.
especially the impure, improper form of heavy metals.
Uh-huh.
In my practice, I use pure herbs, organic herbs,
Okay.
which are tested for heavy metals, which are tested for microbes
Okay.
and yeast and everything.
Uh-huh.
So we are exporting to different countries.
Okay.
But in my practice, I use
Only
pure
herbs,
herbs,
okay.
organic herbs.
Okay.
So heavy metals is not what I
Okay.
think it is not good for kidney failure. They
Okay.
will, of course, they will destroy the kidney.
Okay. Thank you very much. I think viewers will have now enough knowledge, and they will seek this information on internet. Thank you.
Thank you very much.